I think what we've seen today is a pretty fundamental shift in the strategy. What we now have is a second state, after New South Wales has already basically done this as well, a second state now saying that they have thrown everything they can at this outbreak and they don't think there's anything more that can be done to bring this reasonably down to zero in a reasonable amount of time. And so the strategy now is basically bridge until the point at which vaccinations have A, more people protected, and B, start to do some of that work of slowing transmission as well down. And so that advice has come through today or overnight from the Chief Health Officer after this day of 120, so a significant single day escalation. And basically the conclusion that they've drawn is we will expect these case numbers to continue to grow. So that's a really fundamental shift here. No longer is Victoria going to really try and get to zero before open up and kind of continue as it had been before June, July of this year. We're now just basically capping growth in two of the biggest states in the nation. And we're doing so until these vaccination numbers get up. What the government's proposing is basically maintain virtually all of the lockdown restrictions now, with a couple of small changes like outdoor playgrounds being allowed until this number gets to 70%. That's probably a few weeks away, maybe quicker if now that people's freedoms are directly tied to the vaccination rate. Maybe we'll see some more people taking up AstraZeneca appointments in the coming weeks. And then after 70%, it's probably still looks a lot like a lockdown, but with some more concessions that make that a bit more bearable, because that is the world we're in now until we get to phase B, phase C, the point at which vaccinations have an effect. Well, then we are really in essentially a very long lockdown. So what can you do to make that bearable? And of course, it then remains kind of the open question about what happens in the ACT. They're throwing everything they can at this as well. These numbers are remaining very stubborn. They're not escalating in the same way that Victoria's is, but it is earlier in their outbreak. Can they bring that to zero, or are we about to see a third state and territory in the coming weeks basically conclude that Delta is a foe that is far more formidable than what we saw last year? The tools that worked last year are just not working this year. And really, we have no other choice but to lean on what is the ultimate end game and what is the best tool for individual protection against this virus, and that is vaccines.